MMT Trunk flexion, rectus abdominis, external and internal obliques. Position the patient supine with the hands clasped behind the head and the legs straight. Stand at the side of the patient's chest to be positioned to check the inferior angles of the scapula. With no other weakness present, you do not need to touch the patient. If there is hip flexor weakness, you will need to stabilize across the upper thighs with your forearms. Due to the difficulty of passively moving the trunk through flexion, you do not assess the available range of motion in the trunk. In patient-appropriate language, ask the patient to clasp the hands behind the head and flex the trunk until the inferior angles of the scapula clear the table. Common substitutions include any trunk rotation, using momentum to flex the trunk, or protraction of the scapula. Make sure the patient does not pull on the neck with the hands. It may be necessary to have only the fingertips support the head rather than clasped hands. The patient must maintain the shoulder abducted so that the elbows point outward. Do not allow the elbows to come in. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may continue with the test at this point. After correcting any substitutions, ask the patient to perform the motion as previously, while stabilizing if necessary. The resistance in this test comes from the weight of the patient's trunk and various positions of the patient's arms. Grade 5, normal. The patient completes range of motion in trunk flexion with the hands behind the head until the inferior angles of the scapula clear the table. The patient must maintain this position for a 5-second count. For grade 4, have the patient cross the arms over the chest. Grade 4, good. The patient completes range of motion in trunk flexion with the arms crossed over the chest until the inferior angles of the scapula clear the table. The patient must maintain this position for a 5-second count. For grade 3, have the patient fully extend the arms in a plane slightly above the body. Grade 3, fair. The patient completes range of motion in trunk flexion with the arms outstretched until the inferior angles of the scapula clear the table. The patient must maintain this position for a 5-second count. Grade 2, poor. The patient completes partial range of motion in trunk flexion. The inferior angles of the scapula do not clear the table. For grades 1 and 0, reposition the patient so the knees are flexed with the feet flat on the table. For grade 1, you must now support the head and upper trunk off the table. Palpate the rectus abdominis over the linea alba as you ask the patient to attempt trunk flexion. Grade 1, trace. Palpable contractile activity with no movement. Grade 0, no palpable contraction.